All right, perfect. Well, thank you and welcome to the November meeting for the Rural HPV Vaccination Learning Community. On behalf of the American Cancer Society and the National HPV Vaccination Roundtable, I want to thank you for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. We are offering live CME and CNE credits for today's session, and we'll throw some information in the chat for you. During today's session, you will hear from a variety of speakers and organization types talking about their experience increasing on-time HPV vaccinations and what the American Cancer Society considers on-time HPV vaccination is any adolescent completing the HPV vaccination series by age 13. I do want to note that our program is supported by a grant from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. If you want to go to the next slide. So I'm Ashley Locke. I'm a program manager of knowledge translation here at the American Cancer Society. I have the pleasure of talking with you first, but I'm joined by several colleagues here today who are helping to make this session very successful. So thank you. If you want to go to the next slide. So, did you know that in 2026, the HPV vaccination will be celebrating its 20th birthday? So, the first HPV vaccine came to market in June of 2026, which marks a major milestone in cancer prevention. So, for our icebreaker today, I thought it'd be kind of fun to share in the chat. How do you plan to use this achievement to increase HPV vaccinations with your patients and community? So, I'll give you a couple minutes to share, and I will definitely verbally share a few of them here, but would love to get some ideas. All right. So it looks like we've got a couple people already posting in the chat, so I appreciate that. For anyone that's just joining us, we're doing a quick icebreaker, kind of talking about how the HPV vaccine is going to be celebrating its 20th birthday next year, so in 2026. And we are just sharing some ideas of how we're going to use this achievement to continue increasing HPV vaccines within our community. So feel free to type into the chat. You can just share your name and any ideas that you have. So Ruth shared that they will continue to offer all recommended vaccines to everyone who comes in for a vaccine. So thank you, Ruth, for sharing that. That is a great best practice and using every visit as a vaccine visit. Leanna shared looking for creative ideas to get more to say yes to vaccines or to vaccinating. So this might be a really great way, Leanna, to do that. Seema said track record 2 decades. Perfect. Kate shared good reminder to families and patients that this is not a new vaccine. That is very important and very true. Crystal said, knowledge is power, have information ready and printed when discussing, use every visit opportunity as a vaccine opportunity. Perfect. That is a best practice for sure. Julie mentioned, I didn't know this until right now, but maybe it'll be our theme for 2026. So that is a really great idea, Julie, and let us know if you do something. So maybe we can showcase it here. Janet shared promote success rates and utilize personal testimonies. Love that. Lucy shared that we are working on our yearly immunization quality improvement projects and have been talking about motivational interviewing using the cancer prevention angle. Starting this is not a new vaccine, so perfect. That is a great idea. Crystal shared it continues to have a long track record of safety and effectiveness. New meta-analysis just demonstrated it can be used later in life to prevent HPV. Perfect. Thank you so much. There are so many ideas, and please feel free to continue adding them here into the chat, and we can continue to review them throughout. But if you want to go to the next slide, we have a really great poll. So we had some issues last month just to track where people are sort of at when it comes to future sessions and what they would like to hear. So we are going to do it again, and we're doing it in a different way. So please feel free to share in the poll, would you be interested in attending future sessions or discussions focused on rural cancer-related topics? And then from the choices that we give you, you'll have 3 opportunities to share your first choice, your second choice, and your third choice. And then if you do share or pick other, please feel free to share additional details of what you are looking for, because we would like to take this into consideration. And then if you have any suggestions for how we can improve future sessions. And then we are looking for a small group of individuals who would like to be a part of a small focus group in early 2026 to review some rural communication pieces. So if this is something that you would be interested in doing, please feel free to let us know. But in the meantime, we're going to move forward. You guys keep doing the poll. I'm just going to share a little bit about what you'll see this month. So in terms of our agenda, we are going to hear from Crystal Roman at the Louisiana Families for Vaccines here in just a minute. Crystal is going to share her story on vaccinating her son with the HPV vaccine and tell a little bit more about her organization. And after we hear from Crystal, we're going to have a robust panel discussion talking about on-time HPV vaccinations. And we are really lucky to have Ryan Lester here to help moderate today's discussion. As always, I just want to share a couple of reminders. So all of our rural HPV vaccination learning community sessions are recorded and are posted to a public-facing website. So please turn off your camera if you don't want your image recorded. This session is certified for live CME and CNE credits, and we've added a link to the chat detailing out our CME information for today's session. None of the planners or speakers for today's session have any disclosures to share. And then we ask all participants to stay muted just to minimize distractions. However, our Zoom chat is open for questions and support, so please feel free to utilize it. If you want to go to the next slide. So for today's session, we'll be focused on the following learning objectives. We're going to be describing how to increase on-time HPV vaccination rates in rural communities and comparing best practices and challenges in increasing HPV vaccinations in rural settings. So I'm just going to give a couple of more seconds to finish the poll before we move over to Crystal. So for anyone that's just joining, if you want to take that poll really quickly, we would love to hear your feedback and just share with us so that we can make the best decisions for next year's learning community. All right, I think it's slowly going up. I'm just going to give it a couple more seconds. All right. We can go ahead and end the poll. All right, perfect. Well, I'm happy to introduce Crystal to everyone here. So Crystal's going to be sharing her son's HPV vaccination story with us. Crystal is the director at the Louisiana Families for Vaccines. And we are going to include Crystal's full bio in the chat and a way to connect with her on LinkedIn. But Crystal, the floor is now yours.
Thank you so much. Can everybody hear me?
You're good.
Okay. Well, thank you so much for having me. And I think it's just great to be here today because I wear many hats. I'm a social worker. I am a vaccine advocate. And also, most importantly, I am a parent. So today I am excited to talk with you about the work that Louisiana Families for Vaccines is doing, as well as my own personal story around HPV vaccination. So I'll go ahead and go to the next slide. Okay. And you can go to the next slide. So Louisiana Families for Vaccines, we've been around since 2022. We started out as a grassroots nonprofit. We have both a 501c3 and a 501c4, but for the point of today, just really focusing on the community outreach and education component to our organization. But our goal really is to make sure that everybody, whether it is our family and friends, all the way up to our decision makers and leaders in our state are able to have accurate information when they are making decisions about vaccines, whether that's personally to get vaccinated or policy decisions to support strong and healthy kids and communities. So we can go to the next slide. I just wanted to first do some level setting and just take a look at the HPV vaccination rates in Louisiana, and we'll compare it to the state level. But actually, despite the fact that Louisiana does have a lot of health disparities and inequities, we do have a higher vaccination rate compared to the national average. So this is based on 2024 completion rates was 69.1%. You see that it's gone up a little bit. And you can go to the next slide. HPV vaccination rates, according to the Kaiser Family Foundation, was 62.6% across the nation. And it does go down with more than one dose, but at least one dose, we're seeing 78.2% vaccination rates across the nation. You can go to the next slide. And so as we are in this ecosystem of around vaccine hesitancy, we know the HPV vaccine is very safe and effective. But we do see a lot of disparities in Louisiana, especially around our Black and Brown communities. They're more likely to be diagnosed with HPV related cancers. And so really everything that we do, we want to make sure we are centering the lived experiences of the Black community. And so one of the ways that I did that this past year was through a mini grant that was provided by the Foundation for Louisiana to host a Day of Racial Healing event. So January, we had the National Day of Racial Healing. And so I put on not documentary, it was just a film screening of the film The Immortal Life of Henrietta Lacks, which is just most of you probably know who Henrietta Lacks is, but just to give you a brief overview, she was a woman, a poor Black woman that had cervical cancer, and her cells were actually used without her permission to really it was the foundation for a lot of medical advancements in science that we have today. And so this film documents her life and then also raises the concerns around the intersection of bioethics and racism. And so it was a really just a great way for us to explore the HPV vaccine in our community while also making it culturally relevant for folks in our community. You can go to the next slide. Also with that, we have a great organization in Monroe called Power Tools for At-Risk Youth. And the lady on the left here with me, her name is Stephanie Jordan, or Samantha Jordan, I'm sorry. And she invited me to come talk to some youth and their parents. So it was mostly teenage, adolescent females and their moms. And we got to talk about the HPV vaccine and how that is really a power tool that you can use in your toolkit. And so it was part of a greater inspirational day where we had a lot of speakers come and talk about a variety of topics and wellness. And so I was happy to be a part of that. And it was held at the African American Heritage Museum in Monroe. Next slide. So something else that we have incorporated into our community outreach and education. So whether that is going to community health fairs, expos, things like that. St. Jude has a great toolkit that we've utilized called Path to a Bright Future. And actually, the gentleman on the right here who's holding the little sign, that's my husband. He's a family doctor, and he, is very much supportive of all the work that we do as a vaccine advocate as well. And so they have a pledge HPV vaccination pledge. And so I try and encourage folks to sign that pledge. We have it laminated so people can write their name and take a picture, and we can just highlight that, this is something that a lot of people do and they're choosing to protect themselves and their families. So on the left here, this is my son, Toby. He got his HPV vaccine when he was 9. And we know that, recommendations are around 11, but they can be even earlier than that. So I want to make sure that my son, not just my daughter, but also my son, is protecting himself and his future partners from HPV cancers. So that's him getting his first dose, and then he got his second dose a couple of months later. So we're happy to see that and not just encourage others, but we want to walk the walk and talk the talk. So my daughter's 7, so she'll get hers in a couple years. Go to the next slide. So I wanted to share a story about one of our advocates. Her name is Terry Love. And another thing that we really want to do with our organization to increase HPV vaccine uptake is to highlight survivor stories. I think we can give people data and facts and statistics and studies all day, but if they don't necessarily have like an emotional anchor or something that they can relate with or resonates with their life, it may not, they may not take it to heart as much. So Terry's story is highlighted on our website, on our blog. So I would highly recommend that you go to our website and read her story. And if I could just pull out one important fact about her story, it's that the HPV virus is so common. We just see how prevalent it is in our communities and how important it is for all of us to be vaccinated. It's not a moral failure or anything like that. It's just something that happens. And, she's an older lady. And so, she didn't have that as something that was available to her back in the day. So now we see how important it is to be vaccinated, but then also screen regularly and treat HPV. So along with Terry Love, I am looking forward in the future to doing an event with her to promote awareness about HPV vaccination. So recently she went to a survivor retreat that was held in New Orleans, and it was with the communities of color survivor and the Louisiana Cancer Prevention Program. And so there were 2 main goals of this retreat. The first was to give her more tools in her toolkit, awareness about how to bring dialogue to your community. And then the second goal was to actually do it. So you see in this middle picture of her, she's actually out in the community talking to people, using some skills. And so my hope and my dream would be she's coming back to Northeast Louisiana, and she will be able to help me put on an HPV awareness summit to bring her experience and her skills and her knowledge to increase the awareness about HPV vaccination. So in general, we have a lot that we have going on. I couldn't possibly highlight everything that we do in just a few minutes, but if there is a way that you want to partner with Louisiana Families for Vaccines to do a project or advocacy, storytelling campaign, please reach out to me and let me know. We are very excited. Right now, we actually are doing a storytelling campaign around vaccine access. So specifically, if you've been having any issues finding, locating, or accessing vaccines, and if you're in the Louisiana area, we would love to hear your story so that we can highlight it, whether that is just sharing anonymously, or if you were really motivated and you want to do something like a letter to the editor or an op-ed or something like that. We always want to elevate people's voices and their experiences around really any vaccine. So, thank you so much for giving me some time to talk with you about some of the work we're doing, and I'd be happy to answer any questions.
Perfect. Thank you, Crystal, so much for sharing about your organization and for sharing your son's story, and that he got his HPV vaccination at age 9. What a great gift that you gave him. So thank you. You really are making a difference with your work in Louisiana. So I appreciate you for sharing more. It didn't look like we had any questions in the chat, but Athena and others are giving you props for all of the great work that you are doing. So thank you so much. We are going to go ahead and move over to our panel discussion. So I'm going to quickly introduce our moderator, Ryan Lester. He is the Vice President of Education, Health of the Public and Science at the American Academy of Family Physicians. Ryan is a part of the steering committee for the National HPV Vaccination Roundtable, and he is going to be today's moderator for our panel discussion. We're going to add Ryan's full bio to the chat just to save some time. But Ryan, the floor is all yours.
Hey, thank you so much for that warm introduction. I'm so excited to be here for this important conversation today. We have a rock star panel, as you can see. So for each of the panelists, starting with Veronica, I would love to give you the floor and give you a minute to say a little bit about yourselves and a little bit about your organizations.
Sure. Okay. Thanks, Ryan. So hi, everyone. It's good to be here this afternoon. So I'm Veronica Escamilla. I'm here from Blue Cross and Blue Shield of North Carolina. I am a senior strategic advisor in our healthcare and quality division. So much of my work is with our health systems who are in our value-based care arrangements, and that's where we are able to do a lot of interactions with systems on the HPV immunization side of things. So maybe I'll pause there, but I do have some other things to share, but I'll give us a chance to get into the questions.
Excellent. We'll kick it over to Crystal. Thank you for being here.
Hi, thank you. I'm Crystal Skiles. I've been a registered nurse in my community for 27 years. I've been very grateful and very lucky to have practiced in 20 years in the hospital and now almost 8 years in the outpatient setting. I work for a federally qualified health center where we have 4 locations across 2 counties in Wyoming. My biggest passion is that everyone deserves high quality healthcare and access to treatment. I have 3 children and 2 grandchildren, and I'm excited to be here.
Thank you, Crystal. We love to see that passion. We'll kick it over to Bridget.
Thank you so much, Ryan. And hi, everybody. My name is Bridget Freely. I'm an Associate Director of State Partnerships in California at the American Cancer Society, or we also abbreviate it to ACS. So if I say ACS, I mean American Cancer Society. And in my role, I work with state coalitions, our comprehensive cancer control program, as well as health plans, primarily on cancer prevention and screening. And a really big part of my work focuses on HPV vaccination, specifically as cancer prevention. In my role, another hat I wear, I'm also a member of our state's HPV coalition, the California HPV Vaccination Roundtable. And just a little bit of background, it's co-led by our state's Comprehensive Cancer Control Program and the American Cancer Society. And we also have an amazing steering committee of various representatives from health systems and different organizations throughout the state. My colleague Raquel Arias, who some of you may know, does a lot of leadership work for the roundtable, and just want to make sure to give her a proper shout out. My specific role on the California HPV Vaccination Roundtable is I co-lead one of our 3 work groups, the Parent and Community Knowledge Work Group. And a big part of our work as the Parent and Community Knowledge Work Group is implementing an annual public awareness campaign, California HPV Vaccine Week, which really focuses on communicating the importance of starting at age 9 and on-time vaccination. So I'll pause there and I'll talk a little bit more later, but thank you so much.
Thank you for being here, Bridget. That's a lot of gritty local work going on there. Kick it over to Liz.
Hi everyone, I'm Liz Wenzel. I'm joining you from the State Immunization Program with the Minnesota Department of Health. And so as a state immunization program, we manage the Vaccines for Children program within our state. We maintain our state's immunization information system, and we engage providers on clinical immunization quality improvement, as well as vaccine advocacy with both immunizing and non-immunizing partners.
Thank you for being here, Liz. That work is more important than ever. We'll go ahead and get into the line of questions here today. The first we'll kick off with, tell us a bit about what processes or initiatives you've put in place that really focus on the on-time HPV vaccinations. And we'll just open that to anybody.
I think for us, some of the biggest things that we've done, we've made it part of our patient portal. So we do campaigns through our patient portals. We do text message campaigns. We found that, maybe everyone doesn't get in their portal, but everyone looks at their text message, So we've started to do it by text messages. We do an annual sports physical, a free one to our community for those who are uninsured, underinsured. And we used to just do the sports physicals, make sure they got that done. And then we decided we're going to involve vaccines. We really wanted to make sure we were focusing on the Tdap, the meningococcal, and the HPV. So at the beginning of the sports physical, when they're checked in, we pull their wire, which is their immunization registry. We pull that from our state so we know where the child's sitting. A nurse does that, and she gathers all that information. And then if a child is due for some of those vaccines, whichever vaccines we get, the VIS is ready. So we have those. We have the vaccines ready to give at that time so they don't have to come back for an appointment. And if someone doesn't take the vaccine, we offer two things. We offer to sit down and talk with them about the reasons why they don't take it and are willing to educate. Or we offer a later appointment to see if they want to go home and read the information and come back. And that has been probably the biggest impact that we've had. And then just really standing orders. I cannot tell you, if you have standing orders and allow people to work at the top of their licensure, that can increase so many, people that come in just for a nurse visit, or people that just, come in because they need to get sutures. Oh, I see you don't have your HPV. Do you want to get it today? Standing orders are extremely important. And then provider and staff education, just really letting people know we really try to mention this is a cancer preventing medication that we're going to give you. Those are the things we've done at our clinic.
So I can speak next. I'm in a slightly different position because we are not patient facing. So we partner with health systems, and they're the ones who are, seeing the patients and giving out the vaccines. But some of the work we've been doing in the space for the on-time immunizations is with our partners, sharing some up-to-date reporting with them, which they have found useful. A lot of the challenges some of the health systems that we're contracting with was around the data and not knowing which of their patients, who are also our members, had already initiated the vaccine, so they can see, that these patients may still have some open gaps, some immunizations that are missing, but they weren't sure which specific ones they were, or they weren't sure if they had started the HPV immunization itself. So we have enhanced our reporting there so that they can see who has already started it, who has not initiated it. If they're thinking about on-time immunization and reaching that goal of getting everyone immunized by age 13, this is a way for them to kind of help focus those efforts there. In addition to that, we've done some member outreach as well. So we've started doing some back to school email campaigns out to parents, as well as some note card reminders from adolescents age 9 to 17 who have not yet initiated the vaccine.
Excellent.
I can go next. Similar to Veronica's position there, as a state health department, we do not administer vaccines. So a lot of our work with promoting the HPV vaccine comes with our engagement with providers who are the ones administering the vaccine. So we have focused a lot on provider education, both around HPV vaccine basics and communication strategies. We've done this through webinars. We engage providers in this in our site visits for immunization quality improvement program, and we send out newsletters regularly. Another thing we've done is I know we'll talk a little bit later on about HPV at age 9 strategies, but that is also an approach we took with updating the forecaster within our state's immunization information system to begin recommending the HPV vaccine at age 9. And so we've done a lot of work with health systems across the state to educate providers about why we were taking this approach and to encourage those health systems to sort of change their policies or their practices and implement technology updates within their EHR to begin prompting the HPV vaccine with patients as young as age 9. On the flip side, with our public facing engagement, we do send out reminder recall notices statewide. So we've done letters, we've sent text messages, we sent out postcards the last several years, and that HPV messaging has really been focused on cancer prevention and the importance around that. And finally, we've engaged some local graphic designers to create social media graphics and animated videos that we post to our social media accounts.
Very good.
And I'm happy to close us out for this portion. I do want to highlight some of the work of our roundtable as a whole, and then I can dive in a little bit to the California HPV Vaccine Week campaign I mentioned. But our work as a roundtable is done through our steering committee, but also primarily through our 3 work groups. And starting at age 9 is a big focus. We have a health systems and provider work group, and they focus on provider education through virtual learning collaboratives. We also offer a CME announcement approach training for providers about how to communicate about the HPV vaccine. We have a data work group, and they produce an annual county level HPV vaccination report. It breaks it down by county level. There's also really promising data showing that early initiation leads to higher completion rates. They actually just released their 2025 report, which is fantastic, so I can pop that in the chat in a bit. And then finally, the work group I sit on, our parent and community knowledge work group. Our big call to action is California HPV Vaccine Week. And we, to kind of help get this out, it takes place every year during the first full week of August. And we created a website where we house a lot of great resources that we really push out prior to the week and during the week. We have a resource toolkit for health professionals with suggested HPV vaccination messaging for outreach materials. We have a social media toolkit with HPV cancer survivor stories. We also have a clinician testimonial, as well as graphics kind of promoting HPV vaccination, the importance of starting at age 9. And we're really lucky we do have content in English, Spanish, and Vietnamese as well. In years past, we've actually also had dollars to run paid posts on social media through our roundtables social media pages during Vaccine Week. And when we did have these dollars, we really looked at that data report I mentioned, found counties with low vaccination rates, which actually were predominantly rural communities in Northern California, and really targeted those paid posts to go to those communities to make sure that the communities that have lower vaccination rates are getting this message. And I also just want to give a huge shout out. We have an amazing volunteer. Her name is Kim Woodster-Chill. Some of you may know her, who runs our social media accounts, creates these graphics on Canva. So we really could not do this work without her. During the week, we also try to host webinars for health professionals about the HPV vaccination. I'll talk a little bit more about that later. But and then this year, we actually also got some media coverage thanks to a press release that we sent out up in. We got some press coverage, in Northern California, where vaccination rates are a little bit lower. So that's great.
Some really exciting work going on across the board here. One of the themes that I heard pop out of each of your responses was starting vaccination at age 9. I'd love to hear a little bit more about what motivated your organizations to start prioritizing that age 9 start for the vaccine.
Well, unfortunately, I would consider age 9 my biggest challenge was getting that people on board with that. I think the nurses got on board with it initially, and then the family practice providers. But I really struggled to bring the pediatricians on board with age 9, which was really kind of shocking to me. And they really didn't give me, they just felt like waiting till 10 or 11 wasn't that big a deal in that early age group. And so we do have standing orders where nurses can give it. And so if they're in for a nurse visit, a nurse will give it. But if they're in for their routine well child check, um, then the provider is going to delegate which vaccines to give. But that was probably my biggest struggle, was moving people to the age 9. And so I just kept taking it to, I attend our provider meetings every month. And so I would take information, statistics, best practices, things like that to our provider meetings and just really try and highlight um, starting earlier. And the big push to start earlier, is really, it's less pokes if you start earlier. And we really try to highlight that. Less pokes, less opportunity for someone not to complete the vaccine. And so really just trying to highlight those things.
Well, thank you.
So we also had some challenges on our side. They do look a little bit different, but with some of the health systems that we partner with, because we have value-based arrangements, systems are incentivized on this measure. This is sort of part of the program within that they're participating in. And so if you're at all familiar with NCQA or HEDIS measurements, the goal is to meet targets, and it's really focused on getting those vaccinations completed by age 13. So this is where partnering with ACS has been really helpful, because they have all these great resources that we've been able to share with our health systems around, the safety of starting at age 9, getting some of those tips on why it could be helpful. And one of the biggest ones was, starting at age 9, let's say parents aren't comfortable with it. Maybe they decline it those first couple of years, but they can start getting comfortable, or at least used to the idea and having that conversation. So it does give some additional time to potentially complete the series by age 13. We have found some of our health systems, since we've started some of this work, they've kind of rolled out their own initiatives around this and really adopted the age 9, in addition to making some changes on their end with their EMR, but also adopting a lot of the information that's being shared about best practices and really getting those conversations started early with the goal of completing by 13.
Well,
Now, safer here at the Minnesota Department of Health, a lot of what inspired this was that we have very low completion rates across the state that have continued to decline over the years. And so we had been hearing from providers different stories about, families would come in for that 11-year-old well child check and say, I just want my school required vaccines. And HPV is not one of those in Minnesota. And so that was one reason that a lot of families were not consenting to that at the age 11. And we had started to engage HPV vaccine champions within different health systems, and starting to hear some of those success stories where individual clinicians were starting to have those conversations with families at age 9 and having success with being able to administer vaccines at that earlier age. And so being able to kind of pull these stories together and present that to leadership within our state health department helped sort of shift the focus and the support for an HPV at age 9 strategy. I know here one of the biggest concerns with this approach or this strategy was the concern that providers and parents were going to push back on it. And so one of the ways that we address that as well is approaching this with leadership as saying, this is a strategy that we can be really flexible with. And so how do we really be mindful of how we communicate and promote this HPV at age 9 strategy so that it is an option and something that as a state health department we support and recognize that providers or parents are going to be penalized for not starting the HPV vaccine series at age 9 and just like having it be another option.
very good.
I know I'm working for the American Cancer Society, which obviously started age 9 is a big priority for us, and that's a big priority for our work group. So there is a lot of buy-in there, but I think our responsibility and kind of charge is getting that information out into the communities that we serve, and that throughout California, which is a very, very big, very densely populated state. One thing that we did this actually during Vaccine Week this year, we had a Start at Age 9 showcase that was really well represented. So having organizations throughout the state share what they're doing to prioritize prioritize age 9 and how that's helping their efforts. So we had an FQHC speaker from San Diego County. We had a hospital system, a population health department kind of share their efforts. And then also Kaiser, which is a huge provider here in California, and they're doing quite well and kind of share their very unique health system. So kind of seeing how they do this work as well. Another thing I will say that's really helpful, I think, especially when talking to providers, is the data and really showing them that this is an effective approach. So things like our data report, which are demonstrating that starting earlier means more likely to have on-time completion. That's a really beneficial resource to have at our fingertips.
Excellent. You all have talked a bit about some of the challenges you faced as you were working towards working towards age 9, and could you talk a little bit about some of the strategies that you used to overcome those challenges and barriers, or any of the anything in addition to what you've already outlined?
I can mention that so as we found these HPV vaccine champions, being able to pull them onto an MDH-sponsored webinar for providers and really having providers share their stories with other providers, and that helped build this culture of HPV vaccine support at age 9.
Excellent. So provider stories sounds like really impactful.
We've been trying something similar with one of our provider partners from their health system. They've started doing a lot of work on H9, and we've been fortunate enough to have them join some webinars that we've had where they're able to talk about their stories and how they were able to, roll that out within their health system. I will say from a reporting standpoint, it is still a bit of a challenge for us to try to get that is a target that we're working towards, to be able to share that information all the way as early as age 9. Right now we're able to get it to, age 11 to 13, but getting it back to age 9, it's still something that we're working through.
Okay. So, kind of moving through here, um, what, how have you worked to either prepare the vaccinators in your community, to frame and start having the conversation and prepare patients, to complete the HPV series by age 13?
Well, we really start talking about it in the well child checks at the age of 10, asking to start it then, talking about the decrease in pokes if you complete that at an earlier age. And then also in our sports physicals, which in where we live, you have to start doing sports physicals at the end of your 5th grade year. So that's when we do the nurse consultations with their registry information, and just offer to sit down and have a conversation, as opposed to having to go to the internet and not able to answer questions. We offer that information right then and there, and offer a consultation with the nurse to sit and talk about the vaccine and what their concerns are. I think that's been the biggest impact for us. And then if we get that first poke in, right then scheduling the next poke right then. And then electronic reminders about that. Just having everything there ready and available, so it doesn't put someone out. Because I think sometimes people are like, oh, I'm in a hurry. And they're like, we really didn't want to wait around. Oh, we're ready. We can do this right now. And so we work very hard to have, especially during our sports physical week, where we hit probably about 600 or 700 kids during that week, which is a lot. But I make sure that we're well staffed, that we are able to really fluidly get people through so there's not this backlog, plenty of vaccinators, plenty of people to do consultation, good workflows, and it's made a huge impact in our vaccine rates.
That's awesome. So a real systemic approach there. Any other insights? So kind of we're rounding here into the last question of our panel here today. Where have you seen the most success in engaging parents in to support the on-time HPV vaccination starting at age 9?
I think once again, it's just the education piece and willing to talk about it, making sure that we are making sure that we use cancer prevention, as a buzzword, keyword during those conversations. I think that's the biggest piece. Second thing is, most vaccines are expensive, but, we have vaccine programs in our states. Most insurances pay for vaccines. And then I think just being willing to have a conversation. Sometimes people, especially people who are anti-vaxxers, I have an anti-vaxxer in my family, and the biggest turnoff to them, I shouldn't say anti-vaxxer, uh, a vaccine hesitancy. They're not anti-vaxxers, but I think the biggest concern to them was when they were looking for, they were having their first baby and they wanted to discuss vaccines prior to having their baby with whoever might be their pediatrician. When they called around locally and said that, they said, nope, we're not taking you as a patient. Immediately, that was the response. And then the one person, the one clinic, which was ours, that said, hey, yeah, sure, you want to come in and have an appointment and discuss vaccines. And now that child is vaccinated, but it's delayed, but it's vaccinated. But I think just being willing to have that conversation when sometimes you see hesitancy or reluctance and people sometimes get angry and think, why don't you just do that? And people sometimes just want to be educated and make an informed decision and being cognizant of that.
Very good.
I can say that, as a government agency, we know that we are not the trusted messenger for the public. And so a lot of our work really does focus on engaging those trusted messengers within the community. And so providers remain one of the most trusted individuals for parents to turn to for their child's health. And so really working with providers on communication strategies grounded in motivational interviewing, to help address concerns or answer questions that providers bring forward. And then also looking for ways to engage community-based organizations. There are a lot of great community partners throughout Minnesota who are really focused on adolescent health and cancer prevention. And so being able to partner with them and help connect them with the resources that they can bring out into their communities and share this messaging.
That's amazing.
Yeah, I think for us, it's been similar. When we're working with our partners, it's just trying to they ask us and let us know what we might be able to do to help them because they're the ones who are patient facing. So sharing any resources we can, any data, anything that we can give them that might make it easier. So even some of the resources that we've gotten from ACS in the past, where it's just these one pagers on how to answer questions you might get where you can actually just print it out and have it. Sharing that information has been really helpful.
I know for us, for California HPV Vaccine Week, having those HPV cancer survivor testimonials, I think storytelling is probably one of the most powerful things you can do to motivate people. And actually this year, in years past, we'd had funding to sort of boost the testimonials we created. This year, just the funding ran out, which happened. So we actually had to get pretty creative, and we reached out, our social media lead, Kim, reached out to local influencers and influencers on social media. We gave them talking points, but encouraged them to really share their story and post on their social media accounts, tag our roundtable account. And we were actually able to get a lot of eyes without spending any money, and actually not having to exert a lot of effort. So I think sometimes also realizing you don't have to go at it alone, really leaning on your partners, community organizations, members who have a really big reach. And even with maybe just one flyer or one video or one social post can actually reach a ton of people, and it's not a huge, expensive, or timely effort. Another thing, I saw Jane Gray on the call. She's from our California Department of Public Health, and she blasted out our toolkit to her listserv, which I believe is over 80,000 people. So we were able to really just get a lot of eyes on our resources. And I think, I know this was mentioned before, also just providing, especially for providers, providing resources they can just give to their patients that are very turnkey. They're being pulled in so many different directions. And I think just giving people resources they can just easily plug and play is very, very important as well.
That was so cool. So leaning into trusted messengers, finding trusted messengers where they're at, and telling the right stories, how we move the needle here. Um, Excellent. Well, thank you so much for sharing all of your insights today, and your stories, for the incredible work that you're doing around HPV vaccination. It looked like Ashley, do we have time for a few questions here? It looked like there are some questions rolling in the chat.
Absolutely. Go right ahead and ask them.
Oh, let's see. Okay. Um, there were a lot of them rolling in the chat. Trying to catch up here. Um, let's see. There's a question here. This is, how can I get involved if I'm a cervical cancer survivor and I want to bring more awareness to the vaccine, um, to their community?
I think that question is for Bridget. Bridget, this individual is local to one of the counties in California, so I don't know if you could share some ways that maybe she could get involved with the roundtable as well. I did share in the chat we could connect her with Survivor.
Absolutely. We do have an ability to join our listserv and get involved that way. We'll have meetings, and we also have work groups that we're always looking for representation on. And absolutely, every year we do this vaccine week campaign, and we're always looking for people to share their story. So if that would be something you'd be interested in, I know it's not till August, so it's a little bit of ways away, but we can absolutely connect, and I would love to have you involved. And I'm happy to connect to offline via email as well, if that would be helpful.
Well, great making connections. We've got a question here for Liz. It says, what advice do you have for health departments that are considering a change to recommend at 9, or those who have just made that change? What helped to get everyone on board, and what do you know now that you wish you'd known before you made that change? So multi-part question.
Yeah, Matt, you had to throw a tricky one in there, a complex one in there. I would say, one of the big considerations is the communication strategy out with providers. And we found that to be really helpful to really focus the initial outreach and promotion of age 9 to center on providers before we shifted and geared our communication towards parents, really building that provider buy-in, that provider support for that first. So I would encourage health departments to lean on that, or to consider that. And I think what helped to get everyone on board, the HPV at age 9 had been kind of a conversation ongoing for a couple of years here at the State Health Department. And really what helped get the support or the final sign off on, yes, let's move forward with this, was really highlighting effectiveness data for the HPV vaccine. So staying on top of the latest articles that are coming out, and bringing forward the provider stories and kind of what they're seeing and hearing on the ground, both from reasons parents were declining the vaccine and also the success stories that clinicians were having with promoting HPV at age 9.
Well, excellent. Do we have time to squeeze one more in here, Ashley?
Absolutely.
All right, this one's for Crystal. So what have the reactions been from pediatricians who were slow to adopt age 9 initially that eventually tried this approach, and were they pleasantly surprised with the outcomes?
Unfortunately, no. But it did get the conversation started. I mean, pleasantly surprised. At least they're having that conversation now about the HPV vaccine at the 9-year-old well child check, giving them an opportunity to have some additional time to think about it, get some questions answered, get some more information. So I appreciate that at least we've gone to that from not addressing it at all, but at least bringing it up at the 9 appointment. And if someone does say, you know what, I'd just like to get it today, they will give it. Absolutely. Yeah, so I mean, I think they're on board, but it was kind of shocking to me that they were the last ones to get on board with it.
Very good. Well, thank you so much. I think we're at time here. Veronica, Liz, Bridget, Crystal, thank you so much. You all are doing incredible work out there. I'm going to kick it over back to Ashley.
Well, thank you, Ryan, and to all our panelists for such a robust discussion. You guys had some really great ideas, and there were lots of questions in the chat that we didn't get to. So I will make sure to connect individuals that are looking for some of those resources shared. Anything that we can share publicly, I will on the resource roundup. As well, I will make sure to make those connections so that we can get you guys all the information that you're requesting. So thank you again for being a part of today's discussion and for sharing so many great ideas and being vulnerable and sharing some of those challenges as well. So we are going to wrap up today's session. We're going to do a quick poll and share some resources and then talk through some next steps. So here is our poll. It's been a few months since we did our HPV vaccination communication series. And so we want to check in and see what resources you used from that series. So please share with us via the poll. Did you use any of the information we shared? If so, which ones or which topics in particular were you utilizing resources for? If not, if you want to share why, that would be great. And if you are looking for a specific resource for an HPV vaccination communication topic, please, share with us and let us consider it for the future. So I'm going to give you guys a few minutes to take that poll. In the meantime, we can move forward with the slides. So I'll just share while you guys are completing that. All right, perfect. So as we've mentioned in all of our past sessions, but for anyone that is new, we have an external facing website that's built just for you, our rural HPV vaccination learning community. So it's your go-to hub for everything we've shared throughout this session and past sessions. You'll be able to access recordings. I actually already have the slide deck up for you all. You could use it to follow through, and there's ways to connect to all of our speakers as well. So my colleague Brianna is going to drop a link in the chat. So if you haven't bookmarked it, please do so, and it's a resource you'll want to come back to again and again. If you want to go to the next slide. Along with that, we've created a comprehensive resource roundup with topics related to HPV vaccination. So I'm going to be adding resources as we go along, and there are definitely some resources that were shared today that I will make sure to get into the resource roundup, but it's also under important links on our landing page. So definitely, like I said, make sure you bookmark our landing page as well. Take a look at our resource roundup. We're regularly updating it. And if you have a resource that you would want to get added, please contact myself and I will make sure to do that. You want to go to the next slide. So in the next few slides, I'm going to highlight a few continuing education opportunities. So we are nearing the end of our Enduring HPV Vaccine Pharmacy series. So I wanted to quickly highlight it in case you have a pharmacist or a pharmacy tech that you know. This Enduring CE series is available through early December, so there's just a couple of weeks left. It's a two-part on-demand CE series where pharmacy and pharmacy techs can get the latest insights on HPV vaccination, discover effective strategies to raise awareness, and gain practical skills to implement evidence-based interventions. So please share with others that you know in the pharmacy world. It's a great opportunity. If you want to go to the next slide. We also have an on-demand HPV vaccination dental series available for all dental providers, dental hygienists, dental assistants. So we know oral health providers play a critical role when it comes to combating the growing rates of human papillomavirus, HPV-related oropharyngeal cancer. So this four-part series walks through the HPV basics, talks about malignancies, screening, treatment, and survivorship of HPV-related oropharyngeal cancer, and also shares best practices. So this series provides 4 hours of free ADA CERP, which I know is very important to our dental providers. So please share with your dental friends. And this is available at least through the end of December. If you want to go to the next slide. Our panelists did a great job of sharing ways to engage on on-time HPV vaccination efforts. I'm just going to highlight a few others for you. For engagement in education, always recommend the HPV vaccine series starting at age 9 to parents, caregivers, and community members. Walk the talk. If you are a parent to a child 9 or above, make sure that you are starting their HPV vaccine series. There's so many interventions, and there were a lot talked about today. There's many that you can do at the organization level. You can start at 9, have an organization policy by completing by 13, and using every visit as a vaccine visit. Make sure to train all your staff on what HPV vaccination means and any and all policy changes you make around that. Update your EMR system to alert due at 9, trigger automatic vaccine ordering, utilize patient education that emphasizes on-time HPV vaccine and client reminders, whether that be text, postcard, EMR messages, birthday campaigns, etc. Great opportunities as well. And there's always community outreach. Bridget shared social media messaging, using influencers, and sharing materials, with local schools, youth programs, etc. If you want to go to the next slide. I want to thank you all for joining today's session, and we look forward to seeing you for our final 2026 session on December 10th. But until then, I want to wish you all a very happy early Thanksgiving and look forward to seeing you in December.